Male-female ratio of incidence and age relevance in SLE. FM 9. 1. Woman in reproductive age 20 to 40, young female. Is family history relevant in SLE? Yes, positive concordance is seen in 40% of identical twins along with strong family history. Can SLE happen to children's? Yes, and if it's childhood SLE, 100% chances of lupus nephritis are there. Can SLE happen to males? Yes, and it has poor prognosis. Can SLE happen to postmenopausal? Yes, good prognosis. Special features about postmenopausal SLE. 1. No CNS renal symptoms. 2. Anti-dsDNA negative. 3. Anti-RO positive. 4. Sicca, serositis and musculoskeletal symptom present. What's main event in SLE that start whole pathogenesis? Genetic plus environmental factors leads to defective clearance of apoptotic and netotic debris. In SLE, defective apoptotic debris clearance leads to what? It leads to activation of innate immune system activation by activation of PDCS, through toll-like receptors. Which toll-like receptors are involved in SLE mainly? TLR7, TLR9. Which is the central key cell in SLE? Plasmacytoid dendritic cell PDC. In SLE, how does PDC cells lead to further pathogenesis? They produce type 1 interferon INF-alpha, and its main key pathogenic cytokine in SLE. What does type 1 interferon does in SLE? 1. Activates APCs, antigen-presenting cells. 2. Cause endothelial injury. APCs involved in SLE. 1. Langerhans dendritic cells. 2. Macrophages. 3. B cells. What do APCs does in SLE? Present antigens to T cells, and T cell activation happens through Th1, Th2, Th17. Role of T cells in pathogenesis of SLE. T cells activates B cells through following mechanism. 1. IL-4. 2. Bly's B lymphocyte stimulator. 3. IL-12 21st pathway. 4. CD40 ligand. In SLE pathogenesis, Th2 cells activates which interleukins? IL-4, IL-5, IL-13. Role of activated B cells in pathogenesis of SLE. Produce antibodies and immune complexes which are deposited in glomerulus, synovial cavity, vessels. SLE falls under which type of hypersensitivity? Type 3. HLA factors associated with SLE. HLA-DR3, HLA, Dr2. What are non-HLA genetic risk factors for SLE? 1. Early complement deficiency. 2. ERAC gene on X chromosome. 3. TREX gene on chromosome 3. Strongest genetic risk factor for SLE. Early complement deficiency. C1q greater than C2 greater than C4 deficiency. Environmental risk factors for SLE. Oral contraceptive pill, hormonal therapy HRT, UVB rays, Epstein-Barr virus, silicosis, Vit D deficiency, smoking. Which toll-like receptor inhibitor drug is used in SLE? Hydroxychloroquine HCQ. Which interferon alpha inhibitor drug is used in SLE? Anifrolumab. Which Bly's inhibitor drug is used in SLE? Belimumab. Which HLA predisposition is specially risk factor for subcutaneous cutaneous lupus? HLA-DR3.